We'd like to welcome you to the Davis County Business Support webinar series. This session is with our gyms. So we'd like to thank everyone for joining us. My name is Rob Sant. I am the Davis County Economic Development Director. And our panelists today, we have a bunch of great professionals from the Health Department. We have Isa Perry, who is the Public Information Officer for the Health Department. And we have Rochelle Blackham, who is the Environmental Health Services Division Director. Her Deputy Director, Jay Clark, is also with us to help answer some of the questions you may have. Then we also have Kaylee Crossley, who's the Community Health Educator. So kind of just explain a little background of the webinar series. We put together a plan back in early March when we realized that COVID-19 is going to impact our county of how we could help the business community. And part of that was to have some technical assistance, which we've done through webinars, resource lists, and different mailings and things like that. And so we've done a webinar series on SBA loans, and we decided to also do one on to help answer questions that specific industries and businesses have on operating during the moderate and low risk phases of this pandemic. Since we came out with the invitation for this, we've moved to the low risk phase. So we'll be focusing mainly on operating during the low risk phase. We also would just like to, so how this will kind of work is I'll turn the time over to the Health Department and they'll present some general information. And then I will talk briefly about some different financial assistance and other assistance that's available to businesses. And then we'll go to a Q&A portion where we ask you to provide some of your questions that you might have. And there's, at the very bottom of the screen, there's a Q&A box and a chat box. And we ask that you submit your questions there. And please, as the presentation is happening, a question pops in your mind, write it there, and we'll try to answer it during the presentation. And then we'll also bring it up during the Q&A portion. And then if you could also, in the chat box right now, put the name of your business. We'd like to know who we're talking with. And this doesn't really pertain to gyms, but we've had some other ones where it's kind of a general businesses. So we want to make sure we talk specifically on the industries that are here. So please enter your business name. We'd really appreciate it. And with that, I'll turn the time over to Isa.
Hello, everybody. It's good to be with you. Thank you so much for joining us. From the Health Department perspective, it's so important for us to provide resources for businesses. We know that businesses have sacrificed a lot to help manage the disease in our community. We're aware of all your sacrifices, and we want to provide you with as many resources as we can. And we want you to have an avenue to be able to reach out to us, to be able to get your questions answered in the future. I'm going to share my screen so that you guys can hopefully see these slides. I want to share with you some of the data that we have on our website, some of the resources that are on our website, and then we're going to talk the majority of the time will be on the Utah Leads Together 2.0 phased guidance, the low risk or yellow risk guidance that we're in, and Rochelle will dive into some of that. So our website is daviscountyutah.gov/coronavirus. We'll show you some of the data that we have that's updated every day, our frequently asked questions, the yellow guidance documents that we have for industries and for individuals. We have a whole section of posters and signs that are available for businesses, and then a few other resources. So we'll just go to the website so I can show you around for just a second. Every resident in Davis County has access to our most current statistics. These are updated every day. And hopefully you guys are aware that Davis County has done a really good job of managing the outbreak and the pandemic. We haven't had a death since March, and that just shows that everybody's working really hard to protect the most vulnerable. Let's go to the data dashboard. It's this tab right here. And so what you see on this first page is just our overall or cumulative data. You can see that we have had a lot of testing in Davis County. That's another place that we've done really well. With this chart with the yellow bars, you can see that we did flatten the curve, that we've peaked and we've since come down. We are seeing a few cases every day. but not an overwhelming number. Also here in this pie chart, it's our exposures. This big yellow section are known contacts. So that's 63% of people are being exposed by people they know in their household or in a work site or another type of acquaintance or close contact. We still have some travel related, mostly those were in the very beginning of many of them were travel related, and then some where we just don't know where they were exposed. Overall, most people are recovering well at home. We do have some hospitalizations though, and you can see some data about our hospitalizations. We mentioned testing's going really well. We've had a lot of testing in Davis County, and right now only 2.4% of our residents are testing positive. So a lot of tests are being conducted, but luckily not that many people are actually positive. Some people want to know what's more current with the outbreak. So the phased risk indicators right here on the second tab helps you to know currently how many active cases we have, how many current hospitalizations that we have. And this chart right here with the blue bars, this helps us to know that our cases have plateaued. These are weekly averages. And so the fact that our cases have plateaued is one of the reasons that we knew we're ready to move to yellow. There's other factors that play into that, our hospitalization, utilization, ICU beds, and also the way the virus is being spread in our community. But overall, we're trending in the right direction with everything, and we appreciate our community's dedication to really helping us be successful and hopefully getting us opening the economy better, aiding in consumer confidence, getting people out, doing those things that are important for our community. Back on our COVID-19 homepage, I just wanted to point out a few more resources for you. We have our frequently asked questions right here on this tab that has been updated to reflect yellow guidance. This whole section here in the middle is Davis County guidance that we've tried to simplify. I don't know if you've all seen the phased guidelines put out by the state, but they're very extensive, small print. And so we wanted to tease that out, help it make it a little more readable and just bring things that are most important together. So that's all there. And then specific industry guidance can be found right here. And you'll see gym and fitness centers have their own guidance. And we'll click on that so you guys can see that's available on our website. It's just one page, and in yellow, Rochelle will go into the specifics for what you need to know from that. Let's see. Sorry. There we go. I wanted to point out a couple other things down here in the resource downloads. We do have some downloads for businesses. One of these is self-monitoring guidelines. So you know that you've been asked to some degree to ask your staff if they have any symptoms, and this is a good resource for that. You can print from there. Sorry, my little bar keeps moving in my way and I can't see what I'm doing. Okay, there's also posters and signs on our website. Let me click one more place right here. So you can request posters and signs from us if you need them, but they're also available here, things like hand washing and other important messages. So you all know how COVID spread, but we want to just reiterate how important this is. It spreads from person to person through respiratory droplets, and it's more likely to spread when people are in close contact. And the definition of close contact is closer than 6 feet for 10 minutes. This creates a lot of room in work sites for COVID to spread. And really that close contact for more than 10 minutes puts people at risk for exposure. And we have had outbreaks in work sites, little mini outbreaks in restaurants and in manufacturing settings and in healthcare settings. And so it is really important to continue that social distancing and think about how the virus spreads and what you can do to protect people in your environment. Just wanted to show you some of these signs that are available, the social distancing 6 feet apart, wearing a mask, and then helping people to understand what symptoms are related to COVID. And then here's other good messages about not spreading germs and hand washing. So those are all on the website available for you, and let us know if we can help you with signage at all. The phase guidance is a plan put together by the state, both businesses and health professionals, really trying to balance that health and the economy and try to take all of the interests of the state into consideration. And these guidelines help us to respond successfully and get through this pandemic to recovery. So overall, we moved to yellow on Saturday, and it's not huge changes for some industries from orange. What it means for the general public is just that there still needs to be precautions. There should still be social distancing in public settings, face coverings when social distancing is difficult, and then gatherings moved from 20 to 50. We still suggest smaller groups when possible. These are for family groups or other small social groups, private gatherings. However, with organizations, if there's oversight, those groups can be bigger. So a business setting can have more than 50, or some kind of a community group. As long as there's oversight that can ensure social distancing and where people know who's in attendance and that there's a good plan in place, those bigger groups can be approved as long as they're following guidance. There's still a recommendation to limit out-of-state travel, and then definitely do symptom checking before engaging in close contact. So that can be in work settings or sports settings. And high-risk individuals continue to be vulnerable for severe disease, and so they still need to follow the orange guidance and just be more cautious in everything that they do. Now to get to more specific guidance from Rochelle, we'll turn it over to her for gyms.
Thanks, Isa. Give me just a second and I will share my screen. But first off, I am the Environmental Health Director for the Davis County Health Department, and I'm actually really excited to see that I know some of the people in the audience. So of course, if you have any questions, please feel free to use the question and answer while I'm presenting, because Jay is here to help me. So if questions come in, he can answer those as we go. If you have comments, feel free so all the participants can see. And then of course at the end, we'll have the opportunity for you to ask questions. As Isa mentioned, I will be reviewing the general business guidelines. So I'm taking all these guidelines from the phased guidelines for general public and business on the Utah Leads Together, and we are currently using version 4.4, which was released on Friday. So first off, I wanted to tell you that as a general business, there are several sections of this guidance that pertains to you. So that's pages 2, 5, 10, and 20. And then of course, after we go through general, we will do industry specific, and the webinar we're on right now is for gyms. So I'll touch on it as we go through it, but at the end, just know that there will have a slide just for gyms. So first off, throughout these guidance, what we want to emphasize is take reasonable precautions. So the biggest thing here, as Jay and I are out in the field inspecting or reviewing plans, we're noticing that not every gym is the same, not every area is the same, they don't do the same thing. So what works best for you is you're going to know what works best for you. So we're asking you to look at how your business operates and your processes and comply with the guidance and make it fit your business. I will be going over encouraging remote working, symptom screening, social distancing, strict hygiene, cleaning and disinfecting, mask or face coverings, protection of high-risk individuals, and then a couple other practices. So first off, we are encouraging flexible working arrangements. So what that means for you is that could be telework. That could also be hosting some of the athletic classes or courses remotely or virtually. And you'll know your clientele best, and you'll know what classes will work for that and what ones might not. We're also asking individuals, or we're also in the guidance promoting rotating shifts or having staggered schedules on when people can come in and use the gym. Maybe you have, signups where people, you spread out the amount of people that are going to be coming into the gym. And of course, overall, the remote work, if possible, for your employees. The next thing we want to talk about is exercising discretion when returning to the work site. And what we want to emphasize here is we want to treat this as we move from high, moderate to low, or red to yellow, as like baby steps. The dimmer light is turning on the light just a little bit. We don't want to just flip the switch and have everyone back to norm. We want to kind of ease into this to help prevent the spread of this virus. And then as we do meetings like similar today, if you can do them over the phone or virtually, even if you're in the same building, just trying to limit social gatherings. The next thing we want to talk about is symptom screening. As an employer, you should be monitoring your employees for symptoms and well-being. And there's a slide in here, but gyms do need to monitor their employees, as well as if you have team sports or competitions, you need to monitor the participants. And we'll get in a little bit to that. But want to point out that if an employee or a participant becomes sick while they're at your facility or engaging in an activity that you're overseeing, that you should immediately separate them from other kids or clients and ask them to leave the facility. And of course, clean the facility or the workspace, maybe it's the equipment that they used right after they leave. And we're asking you to prohibit employees that have been instructed by the health department to quarantine or isolate. We'll kind of get into that a little bit. Wanting to go over the symptoms. So when I say I want you to monitor your employees and or participants, players, however that might be, you should be monitoring them for a fever of 100.4 degrees Fahrenheit or above. Should ask them if they have a cough, if they're having trouble breathing, a sore throat, sudden change in taste or smell, muscle aches or pain. And another big one to this is whether or not someone in their household has any of those symptoms. Because as Isa pointed out, we have some really good data on the website, and what we're seeing is most of the people who are becoming sick is actually because they have a known contact or a close contact, which in most cases is household or workplace. So if somebody at their home is sick, they're definitely at a higher risk to spreading the disease in your facility. When it says you need to have a verbal checklist or record temperatures, we're saying that how you do this is up to you. In a gym setting, which is the next slide, it is required to take temperature of employees. But what we're saying is the shoe doesn't fit everybody. So you guys decide what that's going to look like. Some of the best examples I've seen out there is QRC codes, where you can scan it with your phone and it asks you the symptoms. You go through, you check it, you're checked in for the day. And then the individual's just holding their own phone. There's never exchange of a pen or a clipboard. Again, it could be a manager that day that does a verbal check and asks the employee who's coming in, or the players or students, whatever it might be, asks all the questions to each individual person and then signs that they asked them to that person. Obviously, what we would like to avoid is having a line for everybody, not social distance, to come sign in and everyone uses the same clipboard and the same pen. So just think about what might work best for you. We have this resource, as you can see, this poster on our website that's available. This is asking employees to self-monitor and take their temperature prior to coming to the facility and assessing any exposure that they might have. For a gym in which you may have individuals coming to the gym that you're not required to take their temperature, this may be a really nice sign to have posted on the door. So again, industry specific. I already mentioned this, but in restaurants and in gyms, you are required to take the employee temperature before shift. Again, it is 100.4 Fahrenheit, and if that's what we're saying is a fever, and if it's higher than that, then they should not enter the facility. So we've had a lot of questions on what thermometers can be used to take these temperatures. So one of the things about moving to yellow is a lot of the equipment is available again. So I know a lot of people who have ordered contactless thermometers are now seeing those come in the mail, so they have their hands on some. If you haven't been able to get any and you have the ability to get one of the infrared laser pointer thermometers, the manufacturers are making statements about those that they're not actually made to take human temperatures, but that is a correction factor that can be used. So if you target the laser right in the middle of the forehead, just realize that it has a 1-inch radius reading, and the forehead reading with those thermometers is going to be 90 to 94. So if that's the best you have available right now, we still encourage you to use it as you work forward in getting the temperature, or excuse me, the thermometers that are made for human temperatures. So the next thing is exposure to COVID-19. So we kind of want to talk about what it means if you're exposed. So ISA did mention that an exposure would be being within 6 feet of somebody for longer than 10 minutes. And if that person then becomes positive, which is reported to the health department, we would ask them who they've been in contact with or who they may have exposed. If we determine that you were exposed to COVID-19, we will reach out to you and let you know that you should quarantine for 14 days. So a couple things, even if you do not get sick during that 14 days, you should be quarantined for the full 14 days because you may develop symptoms during that time frame. So another example, you find out you've been exposed and then you decide to go get tested at day 5, it comes back negative. That does not mean you can return to work. You still need to quarantine, like I said, for the 14 days in case you develop symptoms. And of course, the health department will contact you and give you all this information. And if it's one of your employees, we'll kind of go through that, but you will know, we will write you an exclusion letter, which is coming up. So let's talk about if someone does become positive for COVID. So if they become positive, when can they return to work? So we're saying that they need to be fever-free and have improved symptoms for at least 3 days. And that has to be at least 10 days from when they first became sick. So again, it's going to take some time. If somebody says, well, I tested positive, but I was only sick for 2 days, I'm ready to come back to work. No, these are the guidance that we're using. Even if they feel great after day 3, they still need to at least be restricted from working for that 10 days and 3 days if they're not more to that if they're not symptom free, if that makes sense. Again, if an individual is test positive, yet they have not had any symptoms or they're asymptomatic, never became sick, then we're saying from the moment that you received the positive test, you would still be restricted or should self-isolate for 10 days. And again, we will reach out to the individuals, provide this information to them. Now, how does it work for a facility? If we find out, this is just an example, there is no ABC restaurant out there, at least in Davis County, for the record. So this is just an example that we wanted to show individuals on how an exclusion letter works. So if an employee of yours at your gym, or it could be a teacher, becomes sick and they had contact with individuals, we are going to ask them from the moment that they became sick or symptomatic, we want to look at the work schedule or the schedule of the people that they've been around for 7 days prior to them becoming sick. We're going to ask you and we're going to look through those records and we're going to say, okay, this Eric Olson, he worked with Randy and Robert very closely. They didn't have masks. They weren't social distancing. It could even be in the break room. They had lunch together every day for a week and it was longer than 10 minutes and closer than 6 feet. And then we're going to issue an exclusion letter to the facility saying, hey, these individuals need to be excluded for work while they go through their 14-day quarantine, and we're going to issue the facility this letter. And on there you can see that we try to determine what day they can return back to work. So the next thing we want to go over is social distance. It is important to help spread the disease that individuals stay 6 feet apart. In a gym setting, which we'll get into, even the participants who are working out, the guidance is asking for 10 feet apart. I think that's probably based off of some studies that people have seen. As people are working out, they're breathing heavy, and just the exhale or of the air is kind of spreading further, going further distances. So that's why that 10 feet is in there. We look forward to the moment that we're all on the same page and we just go to 6 feet if possible. But when you're talking about social distancing in a gym, you want to stagger not just workstations, but workout stations, whether that's you spreading out the equipment, whether that's closing off every other equipment, assigning people to certain equipment so that they're not close to each other. I know some places are just restricting the amount of people in there and then using signage saying don't use equipment next to somebody else. You know, you guys are the ones that are going to see what works best for you, but the goal is to provide social distancing. The goal, in addition to that, even when you're working out, is not to face each other. So you're not heavily breathing in each other's faces. That sounds funny, but that's the goal, is not to have face-to-face. And then limit employee to employee contact. And, you know, this is hard. You have break rooms. They haven't seen each other in a while. You know, they're friends, those different things. But we obviously encourage face mask and 6 feet apart as they're working together. Minimize the amount of time that customers are in the facilities. I realize that that may be difficult. You could do sign up so that they're there for a couple hours and leave. We all know that there could be one guy working out the entire day, and that might be something that happens. But then if that one guy becomes sick and had been there every day, everybody in the facility that was in contact with them possibly could be exposed. Limit group sizes when possible. Instead of packing everyone up into one room, if you can hold multiple classes, we encourage reduced group sizes. And strict hygiene, I think this is something that everybody is kind of used to, but we want everyone to wash their hands frequently. We want hand sanitizer, soap, and water to be available for individuals to use. Avoid touching your face. Use etiquette when coughing or sneezing, so you cough or sneeze into your elbow. Don't shake hands. Reduce physical contact. Again, we have these great posters available on our website if you need resources to post these signs. As far as cleaning and disinfecting, I feel like this is something that in the gym setting you guys are very much familiar with, because you're always constantly wiping down equipment. But we're encouraging you to continually clean and sanitize your facility, as well as increase cleaning of high-touch surfaces. So and in the guidance specific for gyms, it says have it available for individuals to use, which every gym I've been to usually has it available. But when we say increase cleaning of high touch surfaces, those may be things that you're not thinking about. Those may be the clipboard and the pen to sign in a guest. It may be the doorknob to open and close the main entry door. Maybe there's doors on the bathrooms, different things like that. Maybe there's a certain machine that just gets used over and over, and we're asking you to do increased cleaning. Immediately clean and disinfect areas if an employee gets sick. That one makes sense. And then of course disinfect between customers and clients. And I know a lot of you are going to rely on the customer or client to do that cleaning. So if you guys can just keep that oversight, and like I said, if one machine gets used a lot, go over there and do some additional cleaning. Encourage your people to do the cleaning. Ask them even if you see them not do it. Okay, so masks and face coverings. So mask coverings should be worn by employees and patrons in which it's difficult to maintain the 6 feet distancing. So you have individuals that are 10 feet apart at each of the workout or circuit equipment. They're not going to be wearing a mask normally. Obviously, we would encourage it. You could even, promote it as it will be a better workout. That was a joke, but can't hear you guys laugh back. But anyways, you could promote them to wear masks if they don't wear masks because they're 10 feet apart. If you have a coach or a teacher or a trainer that's not going to be that 6 feet apart, then they need to wear a mask because they're going to be closer than 6 feet. So hopefully that clears that up in the gym setting. We believe the masks are one way to prevent the spread of the disease, and it's really important for the individuals that are asymptomatic, that they don't even develop symptoms yet have the virus. Again, it doesn't replace hand washing, and just because you have a mask on doesn't mean that you don't have to social distance. It's just an additive protection, and we're hoping that they're worn in public settings, especially, like I said, when social distancing is not possible. We're encouraging the face masks to be cleaned daily, and then a couple do's and don'ts on the face coverings here. Individuals who are younger than 2 years of age, it is not recommended by the CDC for them to wear a mask, or individuals who cannot take on or off the masks themselves. Obviously, there may be people who have trouble breathing, and that would be a case in which you wouldn't want to be wearing the mask. But you want to ensure you can breathe through it. You want to make sure it's fitting correctly and it covers your nose and mouth, and that you're wearing it out in public. And then obviously, like I mentioned, you're cleaning it daily. So some of the small businesses may not have personal protection equipment or supplies that they may need. So that might include face masks, hand sanitizer, or gloves. And we wanted to let you know that state and local programs are here to help. If you're struggling to obtain this equipment, feel free to call our logistics, or excuse me, just one of our phone lines, which is 801-525 5200, and again, it's on the slide. When you call the number, you will be asked to fill out an assessment and an order form. So we've also supplied that link there. So the assessment's going to ask you what business you are representing, how many people work there, what type of supplies you're requesting, how many you have on hand, so that we know how quickly we need to get you those supplies. Okay, so again, it's asking when do we need to wear face coverings? This is just like a really common question that we're getting, and I wanted to point it out and just hit the question, or hit the answer again, that if you cannot maintain the 6 feet distance, you need to wear a mask. Specifically, employees who are working within patrons within 6 feet at a gym. So the employees should be wearing masks within a gym setting. Protecting the high-risk individuals. I think everyone knows this, that the disease is really impacting the high-risk individuals, and unfortunately we've seen some deaths within this category. So we want all businesses to promote or allow remote working for these individuals, help them by having flexible hours or staggering shifts, different workstations to help protect them, minimize face-to-face contact. Hopefully they can work in a position where they can maintain 6 feet distancing. And these high-risk individuals are people over the age of 65, have a underlying health condition, they may live in a nursing home, all of those different things. And I know there are going to be individuals like this that want to get back to the gym, and it's going to be a difficult decision for all of you facilities. So one of the standards in the retail or grocery store is to set aside a time for high-risk individuals, and it may be possible or needed for that to be done in a gym setting. It really just depends on what your clientele are and how eager they are to get back into the gym. Other practices are just avoid handshaking and unnecessary physical contact. Consider different practices like contactless pay options, maybe even partitions between like a reception or a person at the front desk. Again, non-punitive leave policies if possible. Like, we want to encourage individuals or employees not to come to work if they are sick, because that unfortunately is what we are seeing. We have individuals who have gone to work and exposed work sites. The health department has set up an entire mobile unit to go out to work sites to sample, because that's what we're seeing. So it's really important as a facility owner or representative that you really I guess put a little pressure on your employees, but also have that oversight, and you're able to work with them as needed. One of the things I'm not sure I mentioned already is eliminating high touch surfaces, which may include a door. So you may want to prop open the front door or maybe the classroom door if it's possible at times. And then again, CDC has guidance out right now for individuals that are traveling, which may be employees and or patrons that are visiting your facility. And there are some areas still where if they have visited that particular area that they should be self-quarantining for 14 days upon return. And unfortunately, they may want to hit the gym during that time. So I think it's important to really have that questionnaire and just asking them if they have any symptoms or if they've traveled to a high risk area. So industry specific, I want to go through each of these. I believe I already did, but I think it's important to repeat what I've said just for gym settings specifically. So symptom checked of participants prior to a competition or a practice. Again, that could be the coaches, that could be the instructors, but they are going to need to actually symptom check and take temperatures of these participants. So, and we don't know what works best for you. The instructor could go through all of the participants, ask them the question, have it on one paper. They could do it electronically. They could do it as they sign up for a class, that sort of thing. So whatever works best. Limit spectators so that social distancing guidelines can be adhered to. I'm not sure what all the gyms look like out there, but if you have spectators, then you should have them in households. So you have one household together, then 6 feet apart, you have another household as these spectators watch a competition or practice, or maybe it's a game or whatever. Employees working within 6 feet of patrons should be wearing face coverings. So I think we've hit on that. Again, patrons from different households should maintain 6 feet apart when they're working out at all times. We've talked about that and how that might look. Make chemical disinfectants available through the establishment and post signs encouraging disinfectant after use and encouraging the 10 feet distancing. We have signs all over our website. We really want you to take advantage of that. If you need more signs, please let us know. We can help print them. We can help find the right ones for you and get you those signs so that you can just placard all over your facility. And then one thing on here is if you have a swimming pool, you should follow the pool guidance, or public pool, excuse me, if you have a public pool, because that includes hot tubs and everything else. You should follow the pool guidance. And then if for some reason your gym has a swim team or swim lessons, you should make sure this is in the pool guidance, but make sure there's social distancing allowed on the pool deck. And then just in general, if there's, a lot of gyms have, I'm gonna call them a snack bar for lack of a better word, but a food facility within them. Like, we really want to make sure that then that part of the gym follows the restaurant guidance, and that you're thinking about these different areas of where you may have congregation and there may be a line to get a protein shake. And so we want to make sure that you guys have marked out 6 feet for people to get in line, and that you're thinking about all the different places within your gym that there may be people gathering, and maybe you put signs there, or you eliminate what makes them gather there, those different things, so that we're not having any congregating. So lastly, just things to remember about COVID-19 is we're still learning about this virus and the causes of the COVID-19. Unfortunately, there is not a vaccine to prevent COVID-19 right now. The best way to prevent illness is not being exposed. That makes perfect sense. So keeping distance from sick individuals and wearing masks. And we kind of went over it, but taking extra precaution for our high-risk populations. Those are the individuals getting really impacted. And then individual responsibility. We really want to emphasize that the people who are sick should really stay home and avoid spreading the virus. Or use our community partners like you guys to adhere to these guidance and help us keep the numbers low, those different things. And we can't tell you how much we appreciate you already out there. Even listening to this webinar tells us that you guys are trying, and that is all we can ask for here at the health department. We're just, thank you. Last thing here we wanted to say is, or give, is our contact information. So the environmental helpline is posted here on the slide, and that is where I work, and we handle all business questions. We permit all food facilities, pools, those different things. So you have questions like that, please let us know. If you have questions because an individual employee told you that they were positive, we've given you here the nurses line, so you can call and see what needs to be followed up there. We also have the link here to our website that Isa showed you all those amazing resources, and just wanted to provide that link. You can see our tagline here is Davis County Safe, Smart, and Strong. And with your help, I think that we can be all of those things. And then this last slide here, I'm going to turn the time over to Rob really quickly because this is more of his area of expertise.
Awesome. Thanks, Rochelle and Isa. Great job. There's so much great information that's shared during these webinars, and I just want to reiterate their points of thank you for joining us. So this first number up here is my direct line. That's for the Davis County Economic Development Department. We're here to serve the needs of businesses in the county. So please, if you need any guidance regarding financial assistance or any sort of questions on assistance for your businesses, please feel free to reach out directly to me. This next number is this Small Business Development Center at the Davis Tech College. So the SBDC is there to assist small businesses. Andrew Willis is the executive director, and that is his number. They received some additional funding through the CARES Act, so they have an increased capacity on consulting help. So if you have any questions regarding business plans or growth modeling or things like that, feel free to reach out to Andrew. Many of you are aware, the state legislature passed the Commercial Rental Assistance Program, which was $40 million to help businesses with rental assistance up to $10,000. As of last week, that number, only $10 million had been lent out, so there's still $30 million available. So that's the link of where to go to get more information on that program and to know how to apply. And then the last link is with Weber County, we created the Northern Utah Economic Response Team, kind of a team to help counter some of the things with the COVID-19 pandemic. That's a great website that has different links and different resources. So feel free to go to that to get some other resources on SBA loans, other loans. It also is we have a section that highlights corporate giving and kind of some good news stories. So with that, we would like to now go to the Q&A portion of the webinar. I don't believe anyone has asked any questions, except Scott did ask Rochelle if they can get a copy of the PowerPoint that you went over.
Scott, of course, I'll email that over to you.
Perfect. And then also, just so everyone's aware, we're recording this webinar, and probably the next day or two after all the webinars are done, we will post this online, a link online, probably on the health department's website and also on our website. So you can refer back to it and use that as a resource. So now if there's any questions, feel free to write them in the Q&A portion, in the chat portion, or there's also the opportunity you could raise your hand and I can give you permission to ask your question verbally if you don't want to write it out. So we'll give like a minute to write their questions out. So prepare yourself for some silence and then we'll go from there. So Scott asked, with what the health department guidelines for Davis School getting back to athletic competitions, conditioning, weightlifting, etc.
So Scott, I think we definitely want to chat. I did get a plan from a Timothy Best, and that is the school district's plan to return to all of those things: athletic, conditioning, and weightlifting. So the school district has submitted a plan to me. I do have some feedback, and so I'm sure you'll be involved in or hearing the feedback that I give back to this Timothy.
Perfect. And then Shelley asked, can you explain the guidelines for youth sports and social distancing?
Yeah, so Shelly, I said, do you have that paper for there? I don't have it. I wanted to read it exactly from the guidance. So I'll have Isa chime in and read it exactly from the guidance. But youth are allowed to continue back to their sports events, but the coach needs to do symptom check on all of the players. Individuals who are sick should not be participating. And then Isa, do you have I feel like I'm missing something.
Yeah, let me pull that up. Or if one of my team members gets it quicker, they can chime in too.
While you're looking for it, I'll just mention that we're going to be sending out an evaluation form after the webinars to kind of just get your feedback on thoughts, on suggestions on how we can improve, things you found helpful. Our goal is to maybe do more of these as needed, and so we want to know how we can improve the future webinars that we'll be hosting. So please make sure to look out for that link in your email to fill out the evaluation form. Just a quick 6-7 question. Should take just a few minutes.
Isa has a really fun infographic if she finds it, but just wanting to I did miss a small part on the youth sports. So the spectators do need to social distance by household members. And then, like I said, the players or performers should have a symptom check prior to competing. And then there is a section here about distribution of like the orange slices, at halftime. So they're asking that that gets distributed in a manner that wouldn't spread the disease, and there's no congregating that during that time. I said if there's anything you want to add, but that's what the guidance says.
Yeah, that's really specific. Our general highlights are, children can participate in sports and recreation, check for symptoms before playing, don't play if sick, and then spectators wear face coverings when social distancing guidelines are difficult to maintain, but to keep that distance between households. And then one other addition in yellow is that playgrounds are open, but just limit interactions among children. So you covered it all. And if I can get that image pasted in the chat, I will.
Perfect. Thanks, Isa.
Great. Any other additional questions? Okay, perfect. Well, I just want to thank everybody for joining us today. Like I said, we hope that you found this beneficial, and we'll be posting this stuff online so you could refer back to it. And then Rochelle will be sending out her PowerPoint presentation to those that wanted it. And feel free to reach out to the health department or to my department with any questions that you have or any additional assistance. Oh, we have one more follow-up question. Who would be the best person to contact regarding the youth sports?
Yeah, so I believe it was Shelly. I hope I'm not misspeaking. Yeah, Shelly, it would be our division. So our telephone number is the 801-525-5128, and we can help answer some of your specific questions if that's what you have as far as a point of contact.
Perfect. Okay, well, thanks everybody for joining. And as I said, feel free to reach out to us. We're here to help, and hope you have a great day. Thanks.